Good evening, class. We are Group 15. We're going to present about the Trust Me, I'm a Doctor for a special topic in AI for Professor Charles Natalie Williams. In my group, myself, Tushi, and I have Nirosh and Malati. So to begin, AI and robotics are rapidly moving into healthcare and playing a major role in specifically medical functions. So AI is expected to have a tremendous impact on the healthcare sectors, with the estimate market value from 23.85 million US dollars by 2025. So the mostly this focus on human to machine interactions. So in this case, trust play a central role for relationship in a healthcare domain. So the introduction of healthcare AI can potentially have a significant impact on those relationships of trust. So the benefit of AI in healthcare, which including diagnosis of patients, perform a small surgery, monitoring patients' health and mental wellness, and also recently there are devices that do watch your heart rhythm and diagnose it, and independent patient mobility, right? So here we are going to talk about the 4 specific health applications for the so that people can self-diagnose with those applications such as skin vision, RESAP, Cardia, sleep score, and those are the 4 applications. In the next slides, we are going to see the brief description of those applications. So only recently the first consumer-facing AI-driven mobile health app hit the market. So in the past few years, the functionality of the apps has continuously grown by utilizing the data that we collected from smartphone cameras, microphone, as well as the connected wearable devices such as like a smartphone, chest wraps, and a lot of activity wearable devices, right? So these technologies help people to diagnose their health issues without any human interaction. As you see here, some example like a skin vision, right? So it'll detect the malicious skin alteration from the smartphone photo. And the next app is the REST app, which will analyze the noise that capture from your smartphone, smart microphone, and also the Cardia detect. It's the easy. It will detect the easy abnormalizations from the data from an additional sensor. Nowadays, the Apple Watch have that capability, and also the sleep score, which measures the breath and the body movement during the sleep and provide the advice. So now we are going to talk about the related study of this of these applications, and also the security and privacy concern of these applications. So is building the secure AI driven medical health applications are the way to gain people's trust on AI, is a question. So to talk about that, there are 3 papers. That's Kalja ETAI, and Serona ETAI, and Prasad ETAI. So in an early work of Lanja ETAI, they study personal sensing by mHealth application and corresponding privacy concern, in particular with the record of to the different sensor type. And also the participants of these 3-month field studies tend to consider the GPS data like a very sensitive information, and also continuous recording where rate is nearly anonymously negative. And that was Serena ETAI, which conducted an extensive survey on patient clinical communication with the mobile devices, and also investigate the patient willingness to exchange the different type of health related information via mobile devices. And the last but not least, the Prasad ETAI, which is focused on a sharing of the personal health information with the family, friends, and third parties applications and public. In this field, the participants wear a Fitbit device and could change their sharing preferences for the collected data in the customer web portal. And also the researchers found that other people share a certain health information less with the friends and family than with the strangers. That information people less willing to share. It could be information that is indirectly collected by the mobile devices, right? So here, allowing the user to control their medical informations, is it possible? Like it's building a trustworthy health infrastructures and applications, so that providing an end-to-end transparency on how the user data is being processed and shared, disclosing the consequences to the users, and also modeling an AI algorithm with the trustable AI models. So these applications like a Skin Vision's ResApp, Cardia, and SleepCore are meeting the criteria so that it provides the best user self-diagnose applications with all the security concerns that are addressed. And from now, Maladi will walk you through all four applications from here. Maladi, over to you. Thank you.
Thank you for the overview, Tusi. So we'll talk about these so-called M-Health applications. So they've continuously grown by collecting data from the user's smartphone or wearable devices. So one such application is called the Skin Vision app. So it's basically a medical service that is regulated and it takes charge of your skin health. So Skin Vision aids its users in self-examining their skin and it increases awareness on details such as when to act and why. Some of the examples are timely skin cancer detection and personal skincare advice, health path recommendations, and so on. So they have trained this skin vision algorithm with large quantities of images that were previously assessed by their own team of dermatologists. So the algorithm learns which lesions are dangerous and which ones are not. So they continuously train and improve their algorithm with new different sets of images. So all the pictures submitted through the Skin Vision application basically go through this algorithm. So this application is available on Android and iOS. The center of this is the Skin Vision app itself. So it's again, as I said, it's a regulated medical device. It merges the AI technology with the expertise of the expert skin health professionals and dermatologists. So the app even provides the users with specific choices. So the user has the control of whether he or she wants to address any immediate concerns, what steps are to be taken next, and it understands their skin profile. And it can even go to the extent of seeking the most intelligent skincare regimen, or even on a skin seasonal basis from the app. So basically, a service of choice. Moving on to our next mHealth application called the RES app. So we must have heard of or even used several telehealth applications. So they are basically online doctor consultations, online diagnosis. So basically, RES app works hand in hand with such telehealth applications and derives that a cough sound that came out of your mouth or out of your lungs might contain potential information about what was going inside your lungs. So this was used along with the machine learning technology to pull out those signals that are in the cough sound that match to a particular disease. So tool is automated and it absolutely does not need any human interpretation. So the good thing was that this app had undergone multiple clinical trials. It was regulated. It was approved in Europe and Australia with other large markets being pursued. And so the advantages of this app can be experienced with the convenience of our smartphone. So it was a medical tech that absolutely did not require any hardware. So moving on to Cardia, it's a tiny device. It's an external device that is connected to an app on your smartphone. So the patient or the user places his or her fingers on this device and you can immediately see the ECG readings on the smartphone. So it can even be a smartphone or any wearable device or any external device that is connected to the app. So taking an electrocardiogram or an ECG by an additional external device allows for detecting heart abnormalities through the app. And one good thing was it also offers first related features like it tracks data over time and it enables sharing of medical grade recordings through email as well. Moving on to the final application called the sleep score. Insomnia is a rising problem, and there are several applications that promise to analyze a user's sleep using the body's movements and noises. So, this is usually done by using accelerometers in smartphones or even other wearable devices. Sleep Score app uses AI algorithms for assessing a user's sleep. Um, it is an assessment of the quality and quantity of a user's sleep, and it is plotted on a scale of 0 to 100, with the average sleep score being 78. So, after tracking the person's sleep using sleep score, um, the nightly sleep score evaluates the rest or the sleep against six following parameters, um, which are the time to fall asleep, the time in light sleep, the time in REM, deep sleep, and the number of awakenings throughout the night. So these variables are then measured against the known sleep averages of the user's age and gender, which have been established by well published research and expert advisors.
Thanks, Maladi. Will you really trust these ML applications whether you are fully educated about the AI or no knowledge at all? So before that, here author talks about two main trustable AI frameworks needs to be implemented on all these AI applications. Firstly, the AI-driven automation in medical application. This particular trust in automation was investigated by Gazizat. Yeah. For example, who consider trust from the organizational, sociological, interpersonal, and psychological and neurological perspectives. So here, a corresponding integrated framework for accessing automation adoption, the Automation Acceptance Model (AAM), was introduced by Kazizat. Yeah, since understanding of the medical AI intelligence systems, the reasoning is crucial for the user's trust in its results, which described by the Explainable Artificial Intelligence (XAI) framework. This infrastructure supporting methods for visualizing, explaining, and interpreting AI models is gaining increasing trust of the people. So finally, the General Data Protection Regulation emphasize both the complexity and the relevance of the explainable AI system and restricting the types of patient information being shared among the others. So the trust in medical AI system and highlighted the importance of the official certifications. However, today's these approaches are not suitable for non-experts users since they do still require expert knowledge. So let's talk about the mHealth apps from the user perceptions. On the review and analysis of the related work, the author identified the several research gaps regarding the modern self-diagnosis apps and addressing those gaps by answering the questions we will be seeing in the later slides. So here, the author asking the question that would users be willing to use AI-driven apps to contact a medical self-diagnosis? And what are the crucial factors for users to trust the diagnosis of an AI-driven medical health applications? And followed by how would users combine self-diagnosis through an AI-driven app and visiting a medical professional? So, in order to address these questions, the author conducted the survey and collected the quantitative as well as the qualitative data. The questionnaire was implemented using the popular survey tool called SurveyMonkey. So overall, 106 participants took part in the online survey, where the 58.5% are male and 41.5% female participants, with a mean age of 34 years, which means ranging from 19 to 60. The questions were grouped by the topic as follows. The first one, the definition and own experiences. The first author clearly stated that this survey doesn't target typical tracking apps without any diagnosis functionality. For example, sports, the acting trackers, and calories counters, blood pressure trackers, as well as remote diagnosis apps involving the human physicians, and followed by the willingness to use. The author asked people regarding their over willingness to use such apps, and followed by the trust factors. In the following section, the author focused on potential factors establishing the trust in the health assessment app. So, the author asked the participants to which extent they would trust such an app with regard to the type of publisher. So, well known technology concerns such as Apple, Google, or Microsoft, a renowned hospital or startup hospital. And then the interplay and physician. Using an AI driven self diagnosis app could be combined with a traditional doctor's visit in the several ways. And then the expected features. So, as part of this questionnaire, this expected feature, the beside the actual AI driven health assessment, such apps might provide additional helpful features. So, author asked the participants about the subjective relevance of the following potential features on 5 points, the 5 point scale from 1 to 5, which means the listing doctors with relevant information in the vicinity, a recommending a meditation after the diagnosis, and the creating treatment plan after the diagnosis. And furthermore, the participants would optionally add further useful app features as well. And here, this survey shows that none of the proposed form of interplay between the medical experts and the self-diagnosis app would be used by the more than 50% of the participants. That's really fascinating. Yes, so participants provided several further reasons to rely on the results of the self-diagnosis app and potential measures to foster the user's trust, respectively. From their answers, the author derived the following additional factors. The data protection. Yes, several participants explicitly emphasized the importance of the protecting the user health data. They mentioned that the need for strong encryption and authentication with the state-of-the-art technologies. So one participant recommended the processing the health data and determining the assessment locally on the device in order to avoid the transmission of the data at all, and followed by the recommendation by general practitioner. Yeah, a few participations mentioned to trust an AI-driven self-diagnosis app if it was recommended and explained by their general practitioner and their local hospital. Yeah, and the recommendation by renowned experts. Similarly to recommendations by the doctor, they know some participants consider the recommendation by their own renowned experienced medical professional a reason to trust a respective app. So they expecting for their own doctors to recommend or suggest such applications, and then followed by the user reviews and rating. Some participants related to the evaluation mechanism of existing software stores such as reviews and ratings. So the users provided positive experience reports and good ratings were mentioned as another reason to trust a respective app. Yeah. So in overall, the application of artificial intelligence in this paper, it's clearly talked about the which is growing rapidly, the currently with a focus on decision supporting system for physicians. So in this paper, the related features found that there were into the consumer facing apps for self-diagnosis. So while in general, there is a large body of the research on human computer interaction related aspects of the medical health and the telemedicine applications, a deeper understanding of a user perception of such a novel solely AI driven self diagnosis apps is required to guide their designs and development. And thank you everyone, and these are references. Thank you all.